and stressful experiences a woman goes through. Some women have a hard time coping with the adjustment to parenthood and develop depression. In fact, it's estimated that around 1 in 9 women develop postpartum depression after giving birth. If you think you may have postpartum depression, here are some signs to look for as well as some treatment options that can help you feel better. What is postpartum depression? Postpartum depression (PPD) is a mood and anxiety disorder that involves sadness and interferes with your ability to function. It typically begins within the first 4 weeks after delivery and can last for several weeks, months, or longer if it's not properly treated. Those with PPD have some or all of the symptoms of major depression. If you agree with any of the following statements, you may have PPD. I feel sad most of the time. I feel less excited to do things that I once enjoyed. I've had a significant increase or decrease in my appetite or weight not related to pregnancy. I'm unable to sleep, even when I have the opportunity to do so, or I sleep too much. I'm moving around more slowly than usual, or I often feel restless. I feel tired most of the time. I'm unable to concentrate or make decisions. I feel bad about myself, worthless, or guilty. I'm having thoughts of suicide or of harming myself. PPD is different than the baby blues, which affects around 70% of new mothers. During the baby blues, you may have some mild sadness, irritability, and anxiety. However, the baby blues usually goes away within 2 weeks of delivery. PPD interferes with your ability to function and lasts for more than 2 weeks. What causes postpartum depression? There is no single cause of postpartum depression. PPD is typically caused by a combination of biological, psychological, and social factors. Hormone changes. The biological changes that your body experiences after giving birth play a role in depression. After childbirth, your estrogen and progesterone levels drop significantly. This abrupt change in hormones can contribute to mood changes. Some women may be more sensitive to these changes, which can increase their risk of developing depression. Sleep deprivation. Lack of sleep is another biological risk factor for PPD. Sleep deprivation is common for the first few weeks after delivery. But chronic sleep deprivation can be harmful to your mental and physical health. Problems during pregnancy. Your risk of PPD is also higher if you had a difficult pregnancy or delivery. Complications during labor and delivery, like umbilical cord polyps, hemorrhaging, or having an emergency cesarean section, can increase your chances of developing PPD. Additionally, stress related to your baby's health can put you at higher risk for PPD. Common stressors include giving birth prematurely, having an infant born with low birth weight, experiencing complications, or requiring time in the NICU. Mental health issues. Psychological factors also play a role in developing PPD. Your risk of PPD increases if you had depression or anxiety prior to or during pregnancy. Doctors believe that changes in hormone levels are more likely to affect women with a history of depression. Other psychological risk factors for PPD include a history of sexual abuse, feeling conflicted about pregnancy or the baby's gender, and low self-esteem. Poor support network. Finally, problems in your support system, like a lack of social support, marital conflict, or domestic violence, can increase your risk of PPD. When should I get help? For some people, postpartum depression may get better on its own. If you have a good support system and are not dealing with significant stress such as marital, financial, or occupational problems, then you may be able to recover from PPD without treatment. However, other women may find that their PPD does not go away. These women can benefit from getting help. You should seek help for your PPD if you have thoughts of hurting yourself or your baby, have symptoms that seem to be getting worse rather than better, are having a hard time taking care of yourself or your baby, don't feel supported by other people in your life, are drinking alcohol or using drugs to cope, experiencing symptoms of the baby blues, which include sadness, crying, and mild anxiety, is normal during the first 2 weeks after delivery. If your symptoms of sadness and anxiety persist beyond that point, however, then you may be dealing with PPD or another postpartum mood or anxiety disorder. Other postpartum mental health disorders include obsessive-compulsive disorder (OCD), post-traumatic stress disorder (PTSD), and postpartum psychosis. If this is the case, you can benefit from getting help for your condition. If you're concerned that you may have PPD, there are several ways to get help. You can start by talking to your physician, OB/GYN, or psychiatrist. They are medical providers who are trained to prescribe medications that can help. If they feel that you can benefit from psychological treatment, they may suggest that you see a psychologist, therapist, or counselor. How does postpartum depression treated? The type of treatment that's best for you depends on the severity of your postpartum depression. For mild to moderate cases of PPD, psychotherapy is the treatment of choice. In severe cases of PPD, a provider may recommend medications. In these cases, a woman's depression significantly affects her functioning and/or she is thinking about harming herself or her baby. Psychotherapy. Psychotherapy is a psychological treatment for mental health disorders like PPD. You speak with a trained counselor or therapist either individually or in a group setting. You may choose to do psychotherapy either alone or while also taking medication. Different approaches to psychotherapy can help you recover from PPD. The most common approaches are psychodynamic, interpersonal, and cognitive behavioral therapy. Psychodynamic therapy helps you understand how your unconscious thoughts and feelings affect you. You can then learn healthier ways to cope with your emotions. Interpersonal therapy helps you improve your relationships, which in turn can improve your depression. This type of therapy is usually limited to 12 to 20 sessions. Cognitive behavioral therapy (CBT) helps you understand how your thoughts affect your emotions and behaviors. It teaches you how to challenge negative thoughts and create healthier ones. You also learn skills to help you deal with stress, anger, and other emotions. Group therapy is also an effective treatment for PPD. It allows you to connect with other mothers, share advice, and learn new ways to cope with this transition. Medication. Your provider may treat your PPD with medication if your symptoms are severe, you have tried psychotherapy and have not improved, or you have a preference for medication. Selective serotonin reuptake inhibitors (SSRIs) are a type of antidepressant that effectively treats PPD. SSRIs affect levels of the neurotransmitter serotonin in the brain, which can improve mood. These medications include fluoxetine, Prozac, paroxetine, Paxil, and sertraline, Zoloft. Other types of antidepressants have also shown to be effective treatments for PPD. Your provider may prescribe them if SSRIs aren't working. These include venlafaxine, Effexor, bupropion, Wellbutrin, and nortriptyline, Pamelor. These medications are considered safe for breastfeeding mothers of healthy infants. Less than 10% of a mother's dose of an SSRI passes into her breast milk. Other medications are rarely prescribed to breastfeeding mothers, either because they can be harmful or we don't have enough studies on them. If you have concerns about taking medications while breastfeeding, speak with your doctor about the risks and benefits. The bottom line: postpartum depression affects more than 10% of new mothers. Even though it's common, you don't have to suffer. Medications and psychotherapy